Welcome IPPA attendees. Thank you for listening to this presentation. The title of this poster is The Perception of Happiness in Very Severe COPD. I am Dr. Maria Benso. I work for the Mayo Clinic in Rochester, Minnesota, and specifically for the Mindful Breathing Lab. Increasing amount of evidence shows that there is a positive association between happiness, optimism, and active coping with a chronic health condition. Research shows that COPD patients are significantly less satisfied, less socially active, and more disabled. And they perceive their health as poorer than other patients with chronic conditions. There is a substantial body of evidence relating depression and distress with COPD. But we have yet to discover if happiness offers a protective factor that can enhance well-being in these patients. So what we did is we analyzed data from the National Emphysema Treatment Trial, where 1,213 patients with COPD were assessed for happiness using the following question: how often do you feel happy? We aim to investigate the association of happiness, defined as answering all of the time or most of the time to this question, with healthcare utilizations, meaning days in the hospital and ER visits, and general well-being. How do you rate your health? So in other words, we consider happy patients that answered that they were happy or felt happy all of the time or most of the time. And we tried to see what was the association with the healthcare utilization and the general well-being. What we found is that in these sample of 1,213 patients with very severe COPD, adjusting for co-founding factors as Age Medical Research Council dyspnea score, gender, 6-minute walking test, happiness was associated with an average of 1.5 fewer days in the hospital, 0.2 fewer visits to the ER, and 10 points better in general health. So the main takeaway for today is that the perception of happiness could potentially be a protective factor to enhance well-being and active coping with COPD and to reduce healthcare utilization. Interventions targeting determinants of happiness, optimism, hope, meaning and purpose, and positive emotions can be a gateway to better cope and manage COPD. I thank you for listening to this presentation. I am more than happy to network with anyone interested in this topic, and I will leave you with the references.